Thank you so much, Harsha. Thank you, everybody. I am on the board, and I'm leading a patient registry for Cure MIDA Foundation. I also work in pharmaceutical industry for a long time in data analysis. And I came to a rare disease patient advocacy community a few years ago. My newborn daughter died from Leigh syndrome. It's a type of mitochondrial disease. And so Cure MIDA Foundation is an all-volunteer organization, and I help in my daughter's memory. And I bring my knowledge of data analysis into my work with patient registries, and I also help many other patient groups decide on their strategy and help them and advise them on their patient registries. So I'll share about all of that here. So I want to actually start on my second slide. So our foundation, Cure MIDA Foundation, our primary focus is Leigh syndrome. Leigh syndrome is a most frequent type of mitochondrial disease. It affects about 1 in 40,000 people, and it starts between 2 months and 3 years old. But it could also start earlier or later, even in adult age, and it could even start when a baby is just a few days old. And it could be caused by over 110 genetic mutations in nuclear and mitochondrial DNA. And there's a website that our foundation built. It's called About Leigh Syndrome, aboutleighsyndrome.com. It's for both patients and healthcare providers, and I encourage you to see it and learn more about Leigh syndrome there. And just quickly about what our organization does, we have many resources for Leigh syndrome community and mitochondrial disease community. We have an annual conference that we do for Leigh syndrome. We have a lot of patient support resources. We fund research. We have Leigh syndrome global patient registry that I'll talk about. We have a free genetic testing program for anyone with suspected mitochondrial disease. They can get free genetic testing. We have some fun things for families, such as the birthday club. We send a little surprise to kids on their birthdays. We have a corporate advisory council. If anyone here is in the pharmaceutical industry or interested in joining, then please reach out to me. We also work with Critical Path Institute on data sharing for mitochondrial disease community. And so this is kind of our overview. So I want to talk about our patient registry. Our patient registry is done in collaboration with CORDS. CORDS is so it stands for Coordination of Rare Diseases at Stanford, and it's a disease agnostic platform. It has data for more than 2,000 rare diseases, and it works with over 100 patient groups right now. It's a global registry, so anyone in the world can join. Right now, there is data from 95 countries on this registry, and it's patient-reported data. So we are collecting patient-reported data, and patients also have an ability to upload. They can upload any medical records, but the only thing we ask them to upload is their genetic reports. And what we are collecting is demographic information, genetic mutation information, time to diagnosis, specialist seen, symptoms, loss of milestones. So Leigh syndrome is a disease when initially kids appear normal, they can walk, talk, eat, and then later on they lose these abilities, and eventually it leads to death. So we are collecting that information when these milestones are lost, what different children use for disease management, such as feeding tubes, tracheostomy, things like that. Healthcare utilization, so emergency room visits, admissions to the hospital, infections, quality of life, and caregiver burden. And so we've had this registry for 2 years now. We started it in September of 2021, so we're exactly at two years right now. And this is an overview of where we've been able to get in 2 years. So like I said, we've done it in collaboration with CORDS. So our registry is global. We have close to 300 participants now from more than 35 countries. And the important thing is that, so our registry, it's about 70% of our participants reside outside of the United States. So that's actually very unusual for a registry where, you know, our organization is US based. We even applied, we wanted it to be listed in Orphanet, and they said, well, we usually don't list US based registry because even though it's global, it will probably be like 90% United States. And I said, no, we sent them a list of our countries, and they said, oh wow, like, and they added it to Orphanet list. So we're very happy that we've been able to really reach patients globally, and a lot of that is because of the international families that we work with. So we have partner families from many countries in the world, and we translate to different languages, but we also ask these families to reach out to the families that they know, to the doctors that they know in their own countries, and ask how we can work together and to share the information. And so this way we've been able to really, really spread across the world. About 95% of patients in our registry have a genetically confirmed diagnosis. And what's interesting is that about 60% were diagnosed within 1 year since the start of their symptoms. So again, that's very unusual. And usually in mitochondrial disease, what's published in the literature is that it takes patients 8 years or more to get diagnosed. And what we found is that it's important not to necessarily look at mitochondrial disease as a whole, because there are some mitochondrial diseases that affect adults. They're less severely affected. That may be why it takes longer, but if you look specifically at Leigh syndrome, patients actually get diagnosed pretty quickly, relatively quickly. So that's very interesting. Our data is interoperable with CDISC standards. CDISC standards are data standards that are required for submitting the data to the FDA. And we actually work with a CRO called Sumptuous Data Sciences. And we've been able to, we wanted to see if our data would convert to CDISC and what we can learn from it. And it actually converted very successfully. We have these data sets that are available. And we are working, we have a paper that's, it's still undergoing peer review, but soon it will be published, hopefully, and everyone can read it and learn from it. We shared our data with Critical Path Institute. So they have a RDCA dev platform that's funded by the FDA. And so our data is integrated there. And we're also working with them to build a mitochondrial disease task force, which will be sort of a consortium that would include industry partners, academic researchers, patient groups. And so hopefully more people will share data and we can learn more through that. So we are working on that with CPATH. We had a listening session with the FDA last February, and that listening session was specifically to talk about the patient registry. It was with the real world evidence team. And so it was very helpful. We had some really good questions from the FDA. A lot of them were focusing on how we assure data quality, how we validate data. So it really helped us to know what FDA is looking for and kind of make that connection with the FDA. We shared this registry at more than 10 conferences already. We had 4 posters. We have 2 papers. One was published and one is in peer review. And we've shared we shared data with many researchers, with companies, and we shared clinical trial opportunities through that. So our hope when we started this registry was we didn't want to tell the patient community and everybody that we're just starting that registry with the hope that one day the researchers will do something with our data. We wanted to start a registry saying that we're going to do something with this data from the very beginning. And we're going to do it all along. So that was kind of our commitment, and that's what we were doing. That's what we were doing with so far. So throughout my patient advocacy and my work with with this registry and with other groups, I've discovered that there are a lot of challenges for patient groups who start registries. A lot of times the data that's being collected is not used, or nothing really comes out of it. There's a lot of disappointment very often. And so one thing, I've done a few different things, but one thing I've done is I started a working group through Fuse. Fuse is it's sort of a community for data professionals, like statisticians, data managers, or statistical programmers. And I started this working group. It's called Best Data Practices for Patient Foundations and Researchers. And we work on several things, but one of the things we did was we created a few educational guidelines. So we created patient foundations, and we wanted this to be simple and easy to follow. So these are just one-page documents. So one of them is Patient Foundations Guide to Starting a Registry. We did the transparency checklist, and we did something called Myths and Facts. And I have a few of these I put on the table so you can take them. And so we've had really great feedback to that. So hopefully, and we're working on more things, but this is what I'm trying to do, this to help others as they start their registries. So if data is collected in the right way, so can data collected by patient foundations help? So like I said, a lot of times it just nothing happens and it's very disappointing. So, but when it is done in the right way, it can really help. This data can be, these registries can be used to share clinical trial and research opportunities. And if it's set up right, it could be done very easily. In our registry, it's extremely easy to share it. It can really help raise awareness through doing posters, and patient groups can really, if they do it right, that's what I always try to convey to them. It's pretty much as soon as they start a registry, they can start sharing things such as posters, graphics, and it could really, really help. Data can be shared and be made accessible for research. And a lot of times it's easier with the patient groups than, let's say, if a data is collected by academic institutions. So the data can really be shared widely. It can be used to understand patient and caregiver perspectives, understand burden of the disease, and again, make insights widely available. And we know that patients who enroll into research studies and registries, they really, really want their participation to count and to know what's going on, and patient groups are in a really great position where they can really share that. That's all for me. Thank you. You can always contact me with any questions. This is my email, sophia@curomita.org. If you would like, please connect on LinkedIn. I always share what I'm working on. And Curomita Foundation, we also have a very active LinkedIn, Twitter pages. I didn't put the links here, but you can look it up easily, and please follow. Thank you.